Good morning, great Cambrians. Welcome in December. Today is the very first of December, the last month of 2020. This year, your session, I meant to say, totally online session. So, students, uh, as you know, our revision work is going on properly and it's going on fourth time. First time we completed your syllabus, and three time we completed your revision. Now fourth time is going on smoothly, properly. Give proper weightage. Give proper weightage and importance for every subject, so you can do collaboration and you will do good marks. The marks you will get in a combination when you will give proper weightage for every subject. Suppose you are taking more time for economics, English, and not in physical education, so your percentage will not come up. These things you should take care. If one subject is having less marks and two, no meaning of percentage. Your percentage will very low. So, my dear students, we are discussing about physical education and sports for CWSN. The meaning of that, children with special need, is called Divyang. We cannot say handicap. We cannot use this term because our government, our Supreme Court's guidelines are there. We should take pronounce it Divyang. So new term given under guidelines of our central government is called Divyang. So earlier we discussed about so many things, disabilities, types of disabilities, and various causes of disabilities. Today we are having another topic in front of you. Name of that topic is disorder, types of disorder, causes of disorder, and nature of disorder. So there are various types of disorder in human being till childhood to old age. There are list of disorders such as anxiety disorder, then mood disorder, psychiatric disorder, eating disorder, impulse disorder, addiction disorder, we can say personality disorder, obsessive compulsive disorder. You know, in spite of that, this some mental disorders are just like ADHD, mean attention deficit hyperactivity disorder. So we will discuss about then ASD, SPD, ODD, and OCD. There are various types of disorder in human being. So today we will discuss ADHD. Then other four disorders we will discuss afterward. So in this disorder, you know, attention deficit hyperactivity disorder is a mental disorder. So of neurodevelopment types hyperactivity. In other words, I would say disorder which can cure in children and adults also. So what there are more, but there are various chances to occurrence in children's in this disorder. I mean, children are more effective with this disorder. So in this, and we can say it is a medical condition in which a person could not control the person, or we can say a children's could not control on their anxiety and become hyper. You can see children, they are very hyper sometimes. That one to the assumptions 4% to 12% children are affected most in boys in comparison to girls. So, uh, what are the symptoms? What are the symptoms of ADHD in children's? So they could not perform, so able to focus on any kind of pay attention on one task. Just like we are giving a task to a children's, uh, the grade 3, grade 4 of children. They are not attention to what they ask. Difficulty in following instructions. So they are watching games. Children, they can giving them ADHD. What are the causes? Now we discussed about symptom. Now what are the causes? Causes So, if a parents or both the parents are suffering from ADHD, then the most probably children are most likely inherit this disorder. The genetic characteristics tend to pass generation to generation always. So, this is the main causes of ADHD. Then, improper parental care. In case where the mother has had a difficult pregnancy or the child is born permanently, or we can say premature delivery is there, then or born with a very low PhD, then had a having ADHD will increase. Also, we can say uh, genetic cause, as we discussed, low birth weight, we discussed environmental factor. So if surrounding environment is not clear, like air pollution, we can say water pollution, noise pollution, then children can be victim of this disorder. Less brain development. If the brain say disorder uh, in a person, alcohol and drugs always affect adversely on the brain cell. And so now we are having management of ADHD. So to talk ADHD, to control their symptoms and behalf and for example, parents can encourage their children to behave in a certain manner and reward them for the good behavior. So then lifestyle change. According to adopting new lifestyle, I would say adopting changes in lifestyle can prove to be effective in the treatment of ADHD. Lifestyle change, like we should do wake up early in the morning, do physical activities in the morning, yeah, evening session, we should play some games, you know then like regular last for 1 hours, we should do yoga and all. Proper intake of water, reduce intake of sugar, I mean eating habits should also change. Even wearing clothes. Then at the last we are having medical treatment. We should take medical help. Expert advice. Various types of medications may be prescribed for the treatment of ADHD. These medicines help to control the symptoms of disorder. However, medicines should not be taken without counseling, or we can say specialist. So this way we can manage the ADHD, those who are suffering from this, how we can manage it as front of you, children, symptoms in adults. This all be discussed properly. Then is now having second disorder is called dysfunctions. It is neurological. It is a neurological disorder in which sensory information is not received properly. Normally, you see, we take the information throughout our senses, just like airlight. This is disturbed in people with SPD. Just like I told you, we are getting information throughout our senses, just like smell, taste, that can help us to lead our normal life. This is so this is disturbed in people with SPD. Now, what are the symptoms? We can say there are symptoms also, there are causes also, and how we can manage this we will discuss one by one. So these are, we can say Symptoms of SPD, first of all, may cover ears when there are loud sounds such as vacuums, hair drays, dive under the table after hearing the sound of a leaf flower outside the window. Whenever any kind of loud sounds, the children will under with a fear. Then sometimes the sound of rain, wind, smell can also disturb him or her. Sometime vomiting, maybe illness, maybe overreaction. Then dislike hair being brushed or cut. Then cry or get upset over clothing. Then poor concentration. So these are the symptoms of SPD. So now I will describe the symptoms